All right, welcome everybody. Thank you so much for joining us tonight for our Great Waters Group's March program entitled Milwaukee, Get the Lead Out. We're going to have the opportunity to hear from 4 experts on this issue in Milwaukee. And originally it was going to be 5, and one of our panelists sadly had to cancel at the last minute. Richard Diaz won't be able to join us tonight. He's had a family emergency. But one of our other panelists, Ann Batiza, is going to be able to cover the material, some of the material that he was going to present. So we're very grateful for that. So I'm going to begin with just a few announcements about upcoming events that we have, and then I'll introduce the panelists and we'll get into the presentations. So, as probably many of you know, we put on monthly educational programs. In April, traditionally, we do a program for Earth Day. This year, because of the pandemic, we're not doing our traditional program. And so we're encouraging people to go to one of the events that's being organized by our partner organizations. Milwaukee Riverkeeper is holding river cleanups in more than 70 locations, and they're following COVID safety protocols. They're limiting the number of people at each site and requiring everyone to wear masks. And you can sign up for their programs and cleanups by going to MilwaukeeRiverkeeper.org. We also have some programs that are going to be put on by our partner, our sister organization, Nearby Nature. And I don't think David Thomas is on yet. He's going to be talking more about those. So
I just jumped on, Jenny.
Oh,
sorry.
Okay, great. David, do you want to talk about those? The the cleanups that you have and the tree plantings that you have planned in April? Okay, I'm assuming maybe David's having some technical difficulties. We can.
Oh, sorry, my finger hit the wrong button. Sorry. Yeah, if people are getting the Sierra Club newsletter, they should get information on the first Monday of the month about partner events. The Sierra Club is letting us, even though we can't host outings, they're letting us publicize partner events. So there are, because of the way the Riverkeeper cleanup is structured this year, we're expanding the registration sites because they're only allowing 5 people at a time to register over a half an hour period. So when you sign up for the cleanup this year, there'll be a you'll have to register for a particular sign-in time. And we've expanded the check-in points as a result, and I'm going to post some links in the chat window about that. And this coming Saturday, there's a nature walk co-sponsored by Nearby Nature and Northwest Side Community Development. And the exciting news is that Dance Circus has decided to join the walk. It's meeting at Harriet Tubman Park, which is at 47th and Hampton, I believe. And I'll put that information in the chat window eventually as well. So back to you, Jenny.
Thanks, David.
Thank you.
Yep. So we encourage folks to get involved as interest and ability allows in April with some of these cleanup events. In May, our last program of the year is going to focus on Project Drawdown, which is one of the only comprehensive plans that has been developed to address climate change. That's going to be our May 17th program, and that will be another panel presentation. in addition to discussions of Project Drawdown, we'll also have an update on the activities of the Joint City-County Task Force on Climate and Economic Equity. So be watching the Sierra Club e-letter for that announcement. So with those announcements of upcoming events, I will turn it over to our event tonight. So as I said at the beginning, we've got 4 wonderful panelists with us who are going to be presenting information about the lead issue in Milwaukee and also in surrounding areas, because lead is an issue that affects our whole state. So we're going to start with Thomas Welcenbach, who will be covering the history of the lead issue in Milwaukee. Then we'll hear from Ofelia Mondragon and Brian Weaver, who will be talking about services that are available to help deal with lead mitigation and abatement. And we will finish up the evening with Batiza, who will be talking about activism that's taking place around the lead issue and some calls to action that we can all do to address the lead crisis. Before each person presents, I'll provide you with a little bit more information about them. Each panelist is going to speak for about 15 minutes. Anne is going to be covering some of the information that Richard was going to cover, so she'll be speaking for a little bit longer. We ask that you hold your spoken questions until the end, although feel free to type your questions into the chat as we go along so that you don't forget them, and we will make sure that we get to all of them before we wrap up. And we will definitely leave time for questions, so please do make note of those in the chat. So with that, I'd like to introduce you to Thomas Welcenbach. He is a geographic information systems professional and policy analyst with the Get the Lead Out Coalition of Milwaukee. He's been researching lead in Milwaukee's drinking water since joining the Get the Lead Out Coalition in February 2018. The Get the Lead Out Coalition is a grassroots coalition of citizens demanding that a comprehensive strategic plan be created to eliminate all sources of lead poisoning in our community. Thomas uses free and open source geographic information systems technologies as the frameworks to empower the coalition in their efforts to participate in policy discussions directed towards a lead-free environment. So with that, I'll go ahead and hand it over to you, Thomas.
Okay, thank you. So I'm going to present the work that our coalition has done over the past 3 years, and what the Freshwater for Life Action has done beginning since 2016. So I'm going to show some maps, and can you get me on the screen here a second? And I'll briefly touch on the maps. I can share my slides and my presentation if anybody wants to look it over in more depth. Okay, so in 2019, our coalition presented our concerns to 2 Common Council committees, the Rules and Steering Committee, and then again in a special hearing on lead in drinking water in the Public Safety and Health Committee. This is in early 2019. And we had some pretty severe pushback that I want to raise just as concerns from the community to make sure that voices are heard throughout the future when there's issues raised about our health. A letter was sent that was, relatively dismissive of our concerns over water. And my hope in the future is that a letter specifically from the Medical College or UW-Milwaukee will be written to support a community-based organization's efforts to address concerns over lead in drinking water or any other environmental toxin. So we appreciate, now that there's mobilization around this effort, but in the future, we hope that any citizens group that brings a concern to the local government, that our local health institutions will reach out to us and support us and ask what we are concerned about, and then write a letter in support of our actions to further protect ourselves. And we also, had some pushback from UWM and wanted to just raise this issue that, the community often is on the ground and has direct knowledge and experience of what is happening in their communities. And we shouldn't have to be, fighting with our local academic institutions over what is occurring in our neighborhoods. And so there was a letter sent that our research had the potential to cause harm. And we just want, it to be known that our group has been working to address the harms that occurred in our community. And so we're thankful that the chair of the Public Health and Safety Committee allowed us to still present after the local institutions, pushed back on our efforts here. And what we presented was lead poisoning. You can see the maps here: lead poisoning in 2014, lead poisoning in 2016. I can explain these more in depth, but I'm just going to touch on them. The data is represented low to high. And then we have our infant mortality map, and that is represented as infant deaths per square mile. All of the data is on the map and included in the legend. We start at 0 to 9.9. And our concern was that infant deaths in our city were strongly related to lead in our drinking water. And so we started to present more on that. And what happened is that the 2016 map, the original map, low to high, the city changed the representation of the data, and now they changed it to lead poisonings per square mile, but they removed the first category, which makes the lead poisoning in our city appear less severe than it is. And we raised this concern that we can't take the data off the map. We have to have all of the information citywide shown. And the city, instead of putting the data back on, they've now just included the underlying base map on which you put data on top of as part of the data set, when in fact there's no data there. So we've been arguing over this for a long time, and now the proper map on the left, the first map, is being finally used by the main organizations in our city addressing this issue. And we see something similar going on with the maps produced by UWM, where the census tracts, the blood lead levels are being represented as the average blood lead level in the census tract unit. And what this does is it kind of distorts our understanding of the citywide problem by making it look less severe than it is, like the previous map just did. So we see on the east side and in Bayview, it appears, that there's no lead poisoning. The area is great. Unless you really understand what is going on these maps, you look at these areas in the gray and you don't think that there's lead poisoning, because it's showing the average blood lead level of the child, which I find to be a not an effective way to show this. And also, from the research that was used and the data to generate this map, 8,875 records for the children with lead poisoning were removed from the data set. So the map does not factor in all the data for the children poisoned between 2013 and 2016, and the map is incomplete. So if we're going to understand lead poisoning in our city, we need to have proper maps to reference. And now again, this is the first 2016 map, the lead poisoning density map, originally released by the health department to the Common Council in 2018. And then we also have census tract data from the Wisconsin Environmental Public Health Data Tracker. This is from the Wisconsin Environmental Public Health Tracking Program. So here we look at the census tract data, and we can see that this is for elevated blood lead levels greater than or equal to 5, and we need to use these maps. Again, lead poisoning is a county-wide issue. We can discuss more areas in the county that have this issue as well. And what we were looking at is specifically the water. Now, we've been told that it's lead-based paint in old houses is where the correlation is, and that anybody who thinks that water is the issue is that you are wrong, and that's counterintuitive. And I wanted to look into the water because no one else really had provided an overview of the water here and how that was leading to lead poisoning. So we saw from our research maps produced that shows that there was remediation efforts twice. From 1995 to 2007, lead-based paint remediated. Again, from 2004 to 2018, a lot of properties have been remediated, and we still know that there's lead-based paint out there, but our farthest map here on the right is showing blood lead levels 10 micrograms or more between 2010 and 14 in the same areas where a lot of lead-based paint was remediated. So we understand that lead-based paint is still an issue, but we're wondering, if water is contributing in these areas where there's still lead poisoning, where remediation has occurred. So we have been looking at different research that had been kept kind of in the dark, and saw that in the spring of 1993, Milwaukee had high lead levels. 20% of the homes tested at high lead levels. In 2016, HUD found that 45%, a child had 45% chance of being lead poisoned by drinking just 1 8-ounce glass of tap water. In 2015, there was a pilot study in Milwaukee that showed lead levels spike after construction work is done. The city was aware of this from national research. And then in 2017, there was a sample that showed 130 micrograms per liter of lead in our water here at a house that was vacant. So in a vacant property. So we first and foremost were looking at this from an environmental injustice, looking at the technical guidance documents from the Environmental Justice EPA, and that we are identifying environmental justice populations, census tracts that are 50% more African American, and then looking at a federal regulation that is impacting these populations worse. So we're looking at the actions of Milwaukee Waterworks. These are the partial lead service line replacements that are federal regulatory actions that have disproportionately impacted the environmental justice populations. So that's kind of where we started, and then just started to dig into these lead service lines, these partial lead service line replacements. So when we see, the statements that lead-based paint is the correlation to where this is all happening, and then we find this map here, we ask how many partial lead service line replacements, how much this is impacting the lead poisoning in our community. And then again, the foreclosed homes that sat vacant and never had any safety measures in place for the water when they were sold back to the community. We highlighted that as well. And then we looked at houses that are built on vacant lots that reconnect to old lead service lines on the private side, and the city rips out the public side. And so we're looking at these partial lead service line replacements, these foreclosed homes being sold back to the community, and homes being built on vacant lots as direct primary sources of lead poisoning via lead in drinking water. So we don't look at this, and we don't teach the community this, and we don't teach classes we're invited to, that there's a primary source as paint and a secondary source as water. This is very context driven, time and location on whether or not one is the other. And so we definitely see water as a primary source in very specific circumstances. And we looked at infant mortality. I can break this down more, but we really looked at this area along North Avenue where the city-owned properties are and where these new houses were built and where partial lead service line replacements were done, and raise our concerns that the infant mortality spike along North Avenue had to do with partial lead service line replacements. And just the background before I move into the resolutions that were passed on our work, there were resolutions passed before our activism here or the maps that we made. In 2016, there was an ordinance passed that mandated the replacement of lead service lines. Then there was another resolution passed that was meant to educate the community on the risks of lead in drinking water. And then there was the creation of the Water Quality Task Force to make recommendations to the Common Council on how to address lead in drinking water. A couple more resolutions. One was $300,000 was provided to give community education, provide services to the neighborhoods. Another one was to have the health department and waterworks, Department of Public Works, begin to work together to remove all lead service lines from our system. And then the county passed a resolution to provide financial resources to residents who buy county-owned property and want to remediate lead risks. And now the city in 2020 started to provide water filters when they sell a tax foreclosed home back to the community. So a little bit before I finish up here, when we presented our concerns on infant mortality, we had pushback that the line on North Avenue wasn't actually there. It was the result from the overlap in the GIS system from the buffering, that there were no infant deaths on North Avenue, that it was from the points above and below. So then we raised the concern that that would mean that infants were dying above and below North Avenue, and that there are two areas need to have focus on, and not just one. So either way, there is a problem. And so then the Birthing Moms pilot program was created to help pregnant women address lead and water concerns. And we just have more concerns with the work being published by UWM. There's research being stated that, research claiming that the presence of lead in homes and infrastructure alone do not determine whether children are exposed to lead. We've seen numerous cases where lead service lines leach. The city has been applying orthos phosphate because lead service lines break down and wear away. And we just have concerns that, this is institutional racism. If you are publishing research that is dismissing concerns about lead and water, and you're publishing this to policymakers and they're going to ignore lead and water and not enact laws or direct money towards that effort, then this is following that definition here. And I'm happy to talk about this more, but we really need to have one institution that doesn't agree with our efforts on letting drinking water kind of catch up to speed here with what is going on in our community, because we have UW-Madison School of Medicine and Public Health stating the opposite when they review our work and discuss this matter with us. That, thank you for your work and insight on the lead crisis in Milwaukee. It's clear that the lead laterals pose a huge risk of lead poisoning for children and cause adverse perinatal effects. I wish that more was being done to address it. And, just really quick, I'm almost done. We want to just address professional conduct here, that medical doctors and PhDs do not have the right to say whatever they wish to without a reliable peer-reviewed case study on the topic. Medical doctors and PhDs do not have the right to tell the community members that they are wrong without merit, that they do not have the right to delete records from data sets in order to tailor their research findings to their own desired conclusion. And you must start to govern yourselves accordingly in order to more efficiently protect the health of all of our children, not just the ones that you deem statistically significant. Thank you.
All right, thank you very much, Thomas. We'll get to hear more from Thomas in the Q&A section at the end. Thomas, can you go ahead and stop your screen sharing? Thank you. Excellent. So we're going to move on to our next panelist now. Ofelia R. Mondragon is the Residential Services Project Manager for Community Relations with the Social Development Corporation. Ofelia has over 8 years of experience in improving Milwaukee County residents' quality of life through housing rehabilitation, addressing environmental hazards, and code compliance. Ofelia has an undergraduate degree in business management and mathematics. She is a certified healthy homes inspector and lead risk assessor. Ofelia has a passion for the lead poisoning issue and promotes equal quality housing for all as it affects our children and future generations' environment. Ofelia, I'll go ahead and hand it over to you. Thanks.
Thank you, Jenny. Good evening, everyone. Thank you for this opportunity. And as I was getting ready for this presentation, I didn't create a presentation because I really wanted to make this a conversation. Thomas did an excellent job highlighting some of the research, but I think I really want to highlight, and I want to step back and think about how lead poisoning is affecting our children. I did a little bit of data search, and according to the Centers for Disease Control and Prevention and the Public Health Foundation, they pretty much summarize how lead poisoning is associated with reduced brain development, poor academic achievement, and a range of behavioral issues such as learning disabilities and increased delinquency. It also lowers academic scores, juvenile delinquency, and gun violence due to lead poisoning that has been documented in Wisconsin. So I want you to keep that in mind as I read the following information. As I was getting ready for this presentation, I went back and reviewed the audit report that was put together by the Public Health Foundation. And they did an audit and they put a summary together. And I found, and it's just pretty much, I want to highlight this information as we start this conversation. The city of Milwaukee consistently averages over 2,500 positive childhood blood lead tests each year. So it's not a one-time deal. It's been consistently every year for the last few years. I started working in housing and learning about lead poisoning back in 2012. It's been 9 years now, and we're still having this conversation. These numbers are still similar from back then, and we cannot say we've improved. We come a long way. We have a lot of work to do. Out of the 2,500 children that get lead poisoned every year, just in the city of Milwaukee, the city of Milwaukee Health Department only does case management and properly follow up with a lead investigation and risk assessment to 100 of those children. So we're leaving 2,400 children with minimum resources. Even though there are some resources that promote education and community outreach through the lead outreach programs, it's not enough. And I want to highlight that because I want you guys to think about how is that affecting our children, and agree that we have a lot of work to do. I also wanted to share my personal point of view. I have 3 daughters. One of them was exposed to lead poisoning. So it's not just part of my career and my job every day, but then I also is through personal experience. And, you know, in my opinion, lead poisoning is not an issue, you know, and it hasn't been a priority because if you think about it, the population that is affected is our children, especially children under the age of 6. And unfortunately, they're not able to demand a solution nor advocate to fix the problem. And I believe it's up to us that we protect their health and their potential. And with that said, it's been quite a journey learning, you know, some of the opportunities and some of the missed opportunities. I wanted to highlight that information because, as you may be aware, the City of Milwaukee Health Department went through restructuring and also brought new management in place to be able to restructure the department. Now that's going to take a few years before they fix a system that was broken for a few years. Also, the Department of Health Services came on board and also being more proactive and trying to bring more resources to the state of Milwaukee and the state of Wisconsin as well. Some of the resources that are available, not just in the state of Milwaukee, but in Wisconsin, is the Let's Save Homes program. It's one of the programs that is actually committed to provide lead abatement services. It focuses on families with children under the age of 19 who are receiving budget care or Medicaid. And it's focused just on lead abatement. It's investing up to $25,000 in a property. It's a great resource. But we are looking forward to continue provide this resource to those families. Working in housing resources and working with families who don't have the financial means to fix the problem or be able to fix the house. And it's not just about lead paint, but it's a combination of, it's a combination of paint, dust, soil, and water as well. There is a very high possibility that if the property was built prior to 1978 and that family is exposed to paint hazards, there is a very high possibility that also they have the lead laterals. I'll be honest with you, I don't think the state of Milwaukee or Wisconsin, the state of Wisconsin has been collecting water samples from residential properties. I do understand that sometimes they do child cares and also they do schools, but because of collecting enough information for water testing, it's important that we keep that in mind because we need data to tell us if also water is a hazard for our families. But having over 70,000 lead laterals in residential properties is concerning. And we have these children living in those properties exposed to potential lead poisoning. Another resource that is also available in the city of Milwaukee is the Lead Hazard Reduction Assistance Program. That program is operated by the city of Milwaukee Health Department. They are focusing their financial resources to children who have been severely exposed to lead poisoning. Those are the cases that actually receive the nursing case management and the investigation as well. Another program that is starting very soon is called also the Lead Hazard Reduction. SDC is partnering with the Department of Health Services to provide lead hazard reduction not only in Milwaukee County, but also in Waukesha. Another program that is also available is the Community Lead Outreach. Is a home visiting program and also focus on doing education, trying to educate the families and empower them. What can they do to prevent lead poisoning? It doesn't give them enough resources, however, but it's focused on the prevention side of the family in kind of empowering the parents or future parents in how they can protect their children. Being in housing for many, many years, I do see still need of resources for lead abatement. The Let's Save Homes program and the Lead Hazard Reduction program is not enough. And we have to do better. We have to do better in maximizing the resources available for not only the state of Milwaukee, but then also Milwaukee County and the state of Wisconsin. I hope that with the new leadership at the state of Milwaukee Health Department, at the state level, Department of Health Services, and the community agencies willing to work in collaboration and partnership, that we make progress and start bringing solutions. I just wanted to also highlight a recent partnership through the Medical College of Wisconsin. Back in October, we started a collaboration. The Medical College of Wisconsin brought together Children's of Wisconsin, Children's Health Alliance of Wisconsin and SDC to do an assessment and identify, kind of understand the process, what happens when a child is lead poisoned through the follow-up process at all levels, whether it's a severe case that has a formal case management through the City of Milwaukee Health Department, or a level that is not high enough, but still the child has been exposed. And we are hoping through conversations with healthcare providers, the City of Milwaukee Health Department, and other community organizations kind of do an assessment of what is available and what are the opportunities to identify a quality improvement process. Lately, we only started having regular meetings since October, and it's been rewarding to see how everyone is coming to the table and have honest and open conversations and be realistic of what are the resources that we currently have and what are the resources needed to move forward. So I look forward in working with everyone, and we are hoping that we can bring more resources, not only to address the lead hazards in the homes, but then also do a comprehensive improvement, including all the lead hazards.
Great. Thank you so much, Ofelia. That was wonderful. Thank you for all that information on the programs that are out there. We're going to hear a little bit more now about available programs on a state level from Brian Weaver, who has a master's in public health and is a lead policy advisor with the Wisconsin Division of Public Health at the Department of Health Services. He has dedicated his career to making a positive difference for children, families, and communities, working primarily with governmental and nonprofit agencies in the areas of public and population health. He serves as the lead policy advisor at the Wisconsin Department of Health Services and is charged with carrying out Governor Evers' 2019 Executive Order number 36, relating to measures to abate and prevent lead exposure. In this role, he coordinates the development of policy initiatives related to lead exposure, working across agencies and levels of government to develop and implement a comprehensive agenda to reduce lead poisoning and increase lead hazard control efforts in Wisconsin. So, Brian, if you're ready, I'll go ahead and hand it over to you.
I am, yes. Thank you, Jenny. Can you see my slide?
Yes, looks great. Thank you.
Excellent. Thank you. And my night mode just went on, so I apologize for the orange tinge if you can see that, but it's protecting your eyes, I guess. Thank you for the introduction, and thank you for having me as part of this panel today. It was great to hear from the panelists before me. Ofelia, as you can tell from her passion and knowledge, a fantastic advocate for this work and has done amazing work in Milwaukee and in the Milwaukee area. And so she's a great partner for the Department of Health Services. So my role as a lead policy advisor, as Jenny said, is to kind of what I call bringing to life Governor Evers' executive order, which is really focused on reducing and eliminating childhood lead poisoning in the state. So by the end of my presentation, I hope to increase your understanding on lead poisoning in Wisconsin and the impact on children and how DHS and the governor are responding to this critical public health issue. All right, it's not advancing. Did it advance on your end? Oh, I'll use the, there we go. Go off of mute if you can't, if it didn't advance, should be on the second slide. With lead poisoning, no part of the state is safe from lead poisoning. Every county in Wisconsin has had lead poisoned child under the age of 6. The highest rates in 2019 were in the counties of Milwaukee, Rusk, Vernon, Sheboygan, Green Lake, Jefferson, and Rock. The map with red dots provides a visual representation of how widespread lead poisoning is in Wisconsin. Compared to other states, Wisconsin has consistently reported some of the highest numbers of lead-poisoned children in the nation. Over the last 2 decades, Wisconsin and the nation has reduced lead poisoning, but as this graph shows, our work is not done. In 2019, we had 3,111 children under the age of 6 who were lead poisoned. Out of the children tested for lead, 3.7% were found to be lead poisoned. In 2012, the CDC lowered the blood lead level at which interventions should take place from 10 micrograms per deciliter to 5 micrograms per deciliter. So that's why we have this kind of break in the graph where it spikes up again in 2012. And they did this because there's a very large body of evidence that was building at that time that really showed the pervasive effects of lead on every system of the body. CDC now states that there's no safe level of lead. We anticipate that they will lower the threshold once again, in which a child is considered lead poisoned. Lead poisoning in children is primarily caused by exposure to lead in paint in older homes. As we heard earlier, yes, lead in water is a risk. But in Wisconsin, as we see, children who live in households at or below the federal poverty level and those who live in housing built before 1978 are at greatest risk for lead exposure. In Wisconsin, Black children are at greatest risk of lead exposure because they often live in high need areas where the housing is dilapidated or old. Parents have reduced options for housing. They face discrimination. So there are a variety of reasons why we end up seeing this higher rate among Black children in Wisconsin lead poisoning for the state as a whole, and particularly in the Milwaukee region. In Wisconsin, Black children made up 17.9% of children tested, but they accounted for 44.6% of all lead poisoned children in Wisconsin. A closer look at the data, we can see that lead poisoning rates have decreased for all children, but racial and ethnic disparities have persisted. Disparities exist for all ethnic and racial minorities, but are the largest for Black children. Compared to white children who were tested for lead in 2019, Black children had a 4.4 times greater odds of being lead poisoned. Asian children had a 2.1 times greater odds of being lead poisoned, and Hispanic children had 1.7 times greater odds of being lead poisoned. In Wisconsin, family income is a clear risk factor. On average, 85% of lead poisoned children are enrolled in Medicaid. So in this, simple analysis, we use Medicaid enrollment as the proxy for family income and socioeconomic status. So Wisconsin really has made some important progress in reducing childhood lead poisoning, but critical work remains to eliminate this preventable public health issue. I won't dwell on this too much. Ofelia did a really nice job about laying out the impact on children. I will say that the last 3 bullet points actually highlight the impact on adults who had prolonged exposure as children to lead. So this is an issue, and the impact on a child, on the person. What we're seeing, the neurological and behavioral effects of lead are believed to be irreversible, so they can follow you through a lifetime. So it's really critically important to prevent this disease or poisoning from happening in the first place. I did want to highlight the impact of COVID-19 on blood lead testing. This has made the press over the last several months. And most notably, or most recently, the New York Times covered this. I believe it was last Friday or Thursday's paper. And we are seeing similar impact in Wisconsin as well. So the COVID-19 pandemic has mostly increased children's exposure to lead because of the social distancing measures, which has meant that families are spending more time at home. And unfortunately, low-income children living in older homes with lead hazards, who would normally be in a lead-safe childcare or school environment during the day, had now been spending significantly more time at home, potentially increasing their risk to lead hazards. To make matters worse, as this slide demonstrates, COVID-19 had an immediate and ongoing negative impact on Wisconsin's blood lead testing rates among children. Overall, Wisconsin saw a 26% decrease in blood lead testing in the first 3 quarters of 2020 compared to 2019. The children who saw the largest decreases are exactly the children most at risk in Wisconsin: non-white, enrolled in Medicaid, and older than 1 year old. But the Division of Public Health, I'm happy to say, Where I work, we have been paying attention to this issue early on. We noticed this dip in blood lead testing early in the pandemic. We have been taking actions to mitigate the negative impact of COVID on all of our services related to lead. But specifically related to blood lead testing, we are looking at partnerships, really trying to get the message out there to parents. We've been partnering with other providers who work with a similar population. So WIC, immunization program. The Division of Public Health also develops a Medicaid provider report card on blood lead testing. So it essentially reports how well that Medicaid provider, that physician's office is doing around blood lead testing for their Medicaid population. Those report cards would be going out in the very near future, and our research has shown that has had a very positive impact at increasing blood lead testing among Medicaid children. In addition to that, we're partnering internally with the Division of Medicaid Services, looking at how we can encourage and promote this very important issue to Medicaid plans and providers, and encouraging them to take action. Wisconsin's children continue to be affected by lead poisoning. Lead-based paint in older homes is the primary source of lead exposure in children environment. There are approximately 350,000 homes in Wisconsin with lead-based paint hazards. Lead exposure in homes is one of the most harmful and long-lasting ways that poor housing quality affects health, especially for young children. And nationally, children who live in impoverished communities have the highest prevalence of elevated blood lead levels. A history of discriminatory housing practices has created high levels of racial segregation that persist today. And in Wisconsin, most notably in Milwaukee region, that restrict many Blacks to neighborhoods with the oldest housing stock and deteriorating housing conditions. Just to kind of illustrate this point, I find this kind of a useful slide. This isn't Milwaukee, it's actually the city of Fond du Lac. So this was developed by their public health department. And so if you look at this, the darkest brown indicates that at least 2/3 of the homes in that area were built before 1950. The red dot represents a child who has been lead poisoned, and you can clearly see the red dots clustered in the areas of the darkest brown. The lifetime impact, lifetime economic burden of lead poisoning on children is no small matter. It is estimated that it will cost Wisconsin $1.4 billion, which was calculated using the 2019 birth cohort. So it does factor in costs related to reduced lifetime productivity, increased healthcare, education, silver services cost, and also premature mortality. So housing is a critical determinant of health, and substandard housing is a major public health issue. Housing is the determinant of health that can be addressed in a relatively short amount of time through proven strategies that can make older housing healthier. This is not always the case for other social determinants of health like poverty or education that can fall outside of the public health influence and requires many years of major investment and system changes that take years to produce results. But with housing, remediating lead, you can have that lead hazards, make a house lead safe in matters of weeks if the lead hazards are identified, and then you bring in the qualified workers to do the lead abatement work. So this slide, I guess, to kind of show the impact on healthy housing, particularly older housing on a at-risk population, really could have a very significant return on investment. So what is the state doing in response to the childhood lead poisoning crisis in this state? So I'm happy to report, I've only been in this position now for a little over a year. I come on to a team where some people have been doing this work for 2 decades. And they've been leading the nation in many respects in some of their efforts. Yes, more needs to be done, more investment needs to happen, more advocacy around this issue absolutely needs to happen, but I'm happy to report that there is a strong infrastructure within the state that we can build up and really potentially take it to a level where we can eliminate this problem in the state. So within the Division of Public Health, we have the lead and asbestos section, which is made up of 3 programs on 3 areas: the Wisconsin Childhood Lead Poisoning Prevention Program, which is primarily funded through CDC, We had our Lead Safe Homes program, which Ofelia had talked a little bit about. And then the certification training, so kind of our workforce development piece of that work, of that section. So they do a great job. They do everything from data was presenting to you. They do surveillance and monitoring. They provide consultation and oversights to our health departments and community-based organizations and healthcares related to blood lead testing, nurse case management. We work with environmental health specialists out there supporting their lead risk assessments that they do on properties. We have the infrastructure to support lead abatement in older homes across the state, both funding that comes in from our CHIP Medicaid dollars, as well as a HUD grant that we received recently that Ofelia touched a little bit on. In addition to that, our partners at the Department of Natural Resources and the Public Service Commission do provide options for funding for the replacement of lead service line. And we're working really closely with them to making sure that municipalities understand about this resource, how they can access it, and really build up the demand and utilization of those dollars. The Wisconsin's lead and poisoning prevention intervention efforts are primarily managed by local health departments. So the work that we do through the Division of Public Health, we support them through what we call a consolidated contract. So we contract with local health departments to follow up with lead poisoned children. One, also to do the testing, follow up on any child that has been identified as lead poisoning and provide the needed services. It is not funded at a level where, as Ophelia's statistics showed, where those health departments can follow every lead poisoned child. In fact, many of the lead poisoned children, if you look at CDC's definition, do not receive the needed and required services that child needs to address any potential negative consequences of being poisoned. Environmental assessments, lead abatement, lead safe renovations requires the support of local businesses, community-based organizations, so certified contractors, training providers. We need hardware stores and building supply stores to provide the required materials that are needed to do lead safe renovations or lead abatement work. So it really is a comprehensive and coordinated effort that's needed in the state. This is just to highlight the impact of Governor Evers' executive order. It not only brought my role into the Department of Health Services, but it also charged the cabinet agencies to coordinate and align their resources to help with a statewide effort around childhood lead poisoning prevention and response. So the work that often that ties us together are state level policy or budget items, program implementation, coordinating efforts at the state level. I think a real kind of simple example I could share is through the Department of Administration. They have dollars that go out to, for example, community action programs, CAPS agencies that support weatherization of older homes. And so we can bring in and tie in lead abatement dollars where our dollars can go to replace original windows and homes that have lead in them. And so we can go in there, replace those windows. The weatherization dollars can go in and help out with other weatherization projects within that home. So we really can work together to align that work to move it forward. So that's just an example of the potential of Governor Evers' executive order and what he wants done at the state level. Primary prevention strategies are critical too. So funding to fix lead hazards in houses before children are lead poisoned is a critical priority for our primary prevention efforts. Policies that ensure lead safe homes and child care facilities are critical, and educating families so they can protect their children from lead, no matter what the source is an important step that we can take in primary prevention strategies. So it's great that we have these dollars going in to abate homes and address lead and water, but we do need the policies, the funding, the education to tie into that and bring everything together. I believe Ann probably will touch on some of this, so I will just give some real quick highlights. This is what's in the Governor Evers 2021-2023 executive budget. This is what he has proposed to address childhood lead poisoning in Wisconsin. It is a significant commitment, and I hope that no matter where you are on this issue, where you want to focus your time and attention, you probably could find a place for you in this. So we have funding that would go to the Lead Safe Homes program to abate lead hazards in homes, older homes. The Window Plus program, which actually that's kind of that primary prevention, getting in homes that are old, 1950 or older, and really focusing on the major risk in that house, which is replacing those original windows in that home. We can also address other high-risk lead hazards too. The Birth to 3 program, so actually providing services for children who are lead poisoned. As you can see, this would increase the number of children who are eligible for those services. So a significant commitment in the governor's budget to that. And then last but not least, $40 million investment to replace lead service laterals in communities throughout the state. So a really important commitment from the governor in that area, and be happy to talk further about that as well. And I think Anne might even go in greater detail on each one of those. So I know we're holding off for questions. I guess I'll say thank you very much for your time, and I'll pass it back to Jenny.
Thank you, Brian, for that excellent overview on programs that are going on at the state level and the reminder that this is an issue that affects every county in the state. That's great. Well, I mean, it's not great that it affects every county, but it's good that we know that. I'm going to turn it over to our last, but definitely not least speaker. Dr. Ann Batiza is a retired academic and director of SUN, Students Understanding Energy, from Milwaukee School of Engineering, who's the vice president for organization and co-chair of the Natural Resources Committee of the League of Women Voters of Milwaukee County. Today, she will discuss how the League provided a platform for education and advocacy regarding lead issues in Milwaukee, and that the League's membership in the Coalition on Lead Emergency allows for the League to continue to work to protect Milwaukee's children from the disaster of lead exposure. So Anne, I'll go ahead and hand it over to you. Thank you. Anne, are you there?
I'm just trying to unmute myself now. I think I have. Do you hear me now?
Yes. Mm-hmm.
Okay, good. I'll go back to my presentation here. Sorry about that.
No problem. Thank you.
So first of all, I want to thank you, Jennifer, and the Sierra Club for hosting this needed discussion. And I so appreciate the speakers who have come before me. Today, I'm going to discuss the League of Women Voter Milwaukee County's advocacy concerning lead issues in Milwaukee, first through programs that we initiated, and then later through our work with the Coalition on Lead Emergency, or COLE. So lead poisoning, as you've already heard so eloquently, is a completely preventable disease. It requires the political will to remove lead from the environments where not just today's children, but future generations of children will live. Why should we do this? Children who are lead poisoned have, as you've heard, neurological effects that have lifelong impacts on their ability to learn from their parents and surroundings initially, even before they enter school, and then their ability to focus, to process information, and control their behavior after they do enter school. Lead poisoned children are more likely to not graduate from high school and to be incarcerated. At large doses, lead poisoning at the least requires hospitalization, and at worst can cause organ failure and death. So why does society allow this cycle of poisoning to continue generation after generation? We know the causes. The primary cause, as Brian stated, is from homes built before 1978 that generate lead-contaminated dust that children breathe in. or create paint flakes that taste very sweet to children who consume them. For other children, lead comes in from barren soil around the house that has accumulated lead-based paint flaking off from the house. For still other children who are bottle fed, the lead may come unannounced from the water that their parents use to reconstitute formula. If that water enters through lead service lines, where the water has sat and accumulated lead sloughed off from these old pipes, or from internal plumbing or plumbing fixtures that contain lead. How ironic that a simple filter in a water pitcher can prevent this type of poisoning. Why is not every family made aware of and as needed provided with this simple fix and other information about ways to protect their children from lead poisoning? Although our focus today is on Milwaukee, those listening in from other parts of the state need to realize that lead poisoning, as Brian already discussed, is a statewide issue. Lead poisoned children are found in every county of Wisconsin, in large part because every county has old housing stock. Now, I'm using data from 2018. I know that Brian mentioned data from 2019, but the story is essentially the same. The statewide average for lead poisoning in 2018 was 4.5%. So 4 to 5 children out of every 100 children tested around the state were found to be lead poisoned, according to the CDC in Wisconsin standard of 5 micrograms of lead per deciliter of blood. This means that 5 micrograms of lead have been detected for every 1/10 of a liter of their blood. The percent found poison varies across the state, but I'm going to point out some of the counties and cities registering the highest levels of lead poisoning in 2018. So some of those are highlighted here on this map that shows the counties in 2018 with the highest levels. The city of Milwaukee found that 9.2% of those tested were lead poison. And perhaps surprisingly, Waupaca County came in second with 8.5% of those tested who were found to be lead poison. And in third place was not a contest anyone wants to win, was Sheboygan County, where 7.1% of those tested were found to be lead poison. So this graphic shows the highest rates of poisoning within the state in those 2018 data. While Milwaukee, with its plethora of old, poorly maintained rentals, shows the highest percent of lead poisoning among those tested, about 1 in every 11 kids tested. Waupaca County, as I mentioned, is not far behind, with 1 in 12 being found to be lead poisoning. Sheboygan County also has a high rate with 7.1%, or 1 in every 14 kids tested. Ashland County is next with 1 in 16. You can see the city of Racine, 1 in every 17 kids tested was found to be poisoned. Fond du Lac, similar. Dodge County, the city of Waterton, and Rock County all showed rates in 2018 where 1 in 20 children tested were found to be lead poison. And I want to thank Marjorie Coons and Brian from the State Health Department for these data. Now, if you look at the percent of children under 6 tested in 2018, you get kind of a different picture, because even though the city of Milwaukee and Waupaca County have very similar rates of poisoning among those tested, city of Milwaukee tested approximately 26,000 children. And that is 53% of the children under 6 in, not Milwaukee County, in the city of Milwaukee. Waupaca County only tested 15% of their children, and yet the rate of poisoning is similar to that of Milwaukee. If you look across this data, I'm not going to highlight everything, but for example, in Fond du Lac, you have 1 out of, I think that's 17 found poison, but only 17% of the population was tested. Rock County had only 17% tested. So, you can see that it's not just urban centers where lead poisoned children are found. And while the prompt for testing is different in Milwaukee and Racine, where tests are mandated, these data suggest that lead-poisoned children are being missed in many areas of Wisconsin outside of the urban centers. And again, it's important that legislators in this upcoming session consider the needs of local health departments to not only test a much larger percent of children, but to then address the needs of those found to be lead poisoned with home investigations for sources of lead and subsequent abatement. So the way the league got involved in this was within our Natural Resources Committee. And the first question we asked is, what do we know and what is unclear? And our ideas were focused by initial white paper developed by our Natural Resources Committee co-chair, Carol Diggleman. And then we conducted further research. And this led us to develop eventually a series of events on this topic. The first being an initial public issues forum in 2018. That was followed by 2 roundtable discussions in 2019 and another public issues forum in 2020. Sorry, I didn't realize that was there. So this first public issues forum addressing lead issues in Milwaukee focus, we were very fortunate to be able to have as panelists Dr. Helen Meyer, who now is at the University of Michigan. Initially, she was at UW Milwaukee. Michael Stevenson, who is now the Director of Health Strategy at the Milwaukee Health Department, and Carmen Reinmund from the 16th Street Community Health Centers, and she's a lead outreach program coordinator. So we were able to look at research into this area, public policy presented from someone from our Milwaukee Health Department, and then methods of abatement that Carmen provided. And so questions after the presentation highlighted actually the lack of trust within the community and the lack of a common factual basis and understanding to start to have productive conversations. So next we asked, what will advance that conversation when people are obviously very polarized? So we hosted 2 roundtable discussions in 2019 to provide a platform for conversation. And each of these roundtable discussions, they had 30 or fewer participants. We included state and local leaders, including policymakers, community activists, and hospital and medical personnel. We had a very tight agenda set for these events. No one came in with any presentations. In fact, we didn't have a screen for presenting ideas. Instead, we had developed questions for people to address in small groups. And so they did that and developed a consensus answers to the questions, and then burning questions that they felt would promote future actions that needed to be addressed. And these roundtable reports, we wrote up reports on each of the roundtable discussions, and they can be found on our website as given here. So the first roundtable discussion was held in May of 2019. And we're very fortunate that so many people responded to our request to participate in this, and also that Susan Bentz of WWM was publicizing what was happening here. And out of this roundtable, this first roundtable, and this is all in the report on our website, there were 5 themes that emerged. And the first was that there were perhaps technological solutions that could be used to address issues, the possible use and need for additional city-community partnerships, not only for educating parents, but ultimately for funding for abatement that removes lead hazards from the city. A third was the need for healthcare provider incentives and prompts. Currently, prompts for vaccinations during child wellness visits do not include prompts for lead tests because the physician has to go into a separate database to look those up. And now there have been conversations to look at making such prompts possible within the normal prompts a physician would get. The fourth is the use of children as the canary in the coal mine. Current laws require a child found poison to trigger the investigation of a property and subsequent abatement. And so we realized we need to look for collaboration with realtors and legislators to see if in fact the laws can be changed to better protect children so they don't have to be the canary in the coal mine. And finally, we noted the many barriers that parents have to becoming educated about lead hazards, ways they can protect their children, getting them tested, just the physical trial of getting to a place where a venous blood level can be drawn. In our second roundtable, we were testing for sources of lead poisoning and preventing lead poisoning. And again, Susan Bentz very kindly covered this roundtable as well. And the outcomes were really a common knowledge base that reduced tensions. We found that people were very open during these discussions. And again, we had state and local policy leaders along with community activists, representatives from major hospitals and physicians. And everyone was, I think, extremely open and receptive to other people's ideas and very respectful in the way they listened to each other. Out of this also came some collective and individual actions, and importantly, a focus on the north side of Milwaukee. This is data from that EPH tracker provided by the Department of Health Services. This is data from the county of Milwaukee, and it's cumulative between 2013 and 2016. And I think you can see this is the percent of children tested found to be lead poisoned in Milwaukee County. And you can see that it really creates this target on the north side. In that yellow selection, 1 in 3 children tested is found to be poisoned. I mean, this is hair on fire, outrageous news. I mean, it's not news. People have known this for a long time, but it's awful that we allow this situation to continue because we allow those properties to continue to contain lead and continue to poison generation after generation. The 38 census tracts around that yellow tract, in those tracts, at least 1 in 4 or 1 in 5 children tested were found to be poisoned. We also think that this provides a concrete visual for politicians, philanthropists, and I hope realtor associations to literally decide to get the lead out of Milwaukee. And particularly here on the north side where generation after generation of children have been poisoned. Notice that the south side of Milwaukee, where the federally funded 16th Street Community Health Centers has 3 different centers, and they aggressively test and visit the homes of lead poisoned children, and they act at the level of 5 micrograms per deciliter. And so, in fact, you find a much lower level of poisoning there where parents had, at this point, had very good access to educational materials. So finally, in 2020, on March 6th, just before COVID shut everything down, we asked the question, what can we do to change lead policy? And so we hosted a public forum to focus priorities specifically on the north side of Milwaukee. And we had, it was called Lead Issues in Milwaukee, Spotlight on the North Side. And we had 13 speakers provide their priorities for the north side and the resources needed. And you'll look at several, these were our speakers for that event. Everybody had 3 minutes to give their priorities, the resources that were needed, and I believe the resources that they could bring to the table. Notice that several of the panelists, Brian and Ofelia, were again, generously gave their time to be part of that event. We had Steve Elmore, who's the head of the director of Drinking Water and Groundwater Program at Wisconsin DNR, and Dr. Heather Paradis, who's now with the Milwaukee Health Department, but was the medical director of community services at Children's Hospital in Wisconsin. Jamie Fershinger, director of environmental health at 16th Street Community Health Centers. Karen Detmer, superintendent Milwaukee Waterworks. Helen Meyer again from UW Milwaukee. Alicia Branch is the aunt of an affected child. Deanna Branch's son, Aiden, has been terribly affected by lead, and Alicia spoke about that personal experience. And you can see others, Jean Hewitt, Dennis Jacobson of Cole, a very strong leader at Cole, Matt Steenstra of Hunger Task Force. Tom also was part of this. Thank you, Tom. And Connor Williams, the Community Advocates Public Policy Institute. So this also gives you a flavor of who was at those roundtable discussions, because many of these people were also there. And out of that, really, came the idea that addressing the lead poisoning of children on the north side of Milwaukee is in fact a moral imperative. And again, the need for foundations in Milwaukee to become part of the solution was raised, and unfortunately not many foundations were represented in the audience, but we hope that they will begin to see this as a place where they can have an enormous impact. So the League has continued its work through the Coalition on Lead Emergency, COLE. And through COLE, I'm the representative from the League, and as a member of various committees within COLE, I've been able to participate as they met with health department and alders, people from the health department and alders, to help develop legislation, increase funding. They met with Dave Nelson of Medical College and Ofelia, who's now with the SDC. And just recently we met with members of the Lead Safe Cleveland Coalition, which is an amazing story of how you actually get the lead hazard out of a city. The COLE is also helping to develop educational materials. We've testified at budget hearings. COLE really spearheaded the Birthing Moms Project, which was successfully passed in the 2019 Milwaukee budget, and also spearheaded work with, and again, working with the alders and with the health department members to fund lead assessments for all poisoned children at the 5 microgram per deciliter level instead of the 20 microgram level that they were using. What that means is in 2019, 115 children were in Milwaukee were tested at or above the 20 microgram per deciliter level, which meant they could have someone come in to do a home assessment. But that left out 1,745 other children who were in fact determined to be lead poisoned, but they were between 5 and 19 micrograms per deciliter, and they needed that home assessment in order to not continue to be poisoned, not have their siblings continue to be poisoned, and all other family members who live there. So the League continues to work with COLE and maintains media ties as this work goes forward. Right now, COLE has submitted requests for the 2021 to 2023 budget. And I'm just going to briefly mention that numbers 1, 2, and 4 would provide funds for local health departments to lead investigations, educate parents, and test children. Requests 3 and 5 deal with funds for lead abatement, and request 6 deals with funds for replacement of lead service lines. I think that Brian mentioned several of these that were already in the Governor Evers budget, and I think that includes the Windows Plus program, which is number 5, the Birth to 3 program to expand services to eligible children who've had a blood lead level test of 5 micrograms per deciliter, and the 40 million lateral service line replacement. And then the also an additional funding to leverage additional federal dollars for the Lead Safe Homes program. So my personal, I'm not talking for the league here, but my personal priorities to combat lead poisoning are to remove lead from the north side. I hope that we can develop public-private partnerships to get the lead out of the north side. And I wonder if realtor associations can also recognize the need to protect children, so they're no longer the canary in the coal mine, that they can be assured that they're going to move into homes that are not going to poison them. And I think that we need to replicate the 16th Street Community Health Centers on the north side. That has proven to be so successful on the south side. In addition, I think we need to increase testing of children around the state. One can only imagine how many lead poisoned children are being missed because they're not being tested. And we need to fund local health departments to respond at the 5 microgram per deciliter level with assessments, parental education and abatement, and fund the remaining coal priorities, because increased funding is validation that the lives of Wisconsin's children matter. Thank you very much for your attention. Questions are welcome during the Q&A, and my email address is here. I can put that in the chat if you wish. And there are links here for resources related to and reports related to the roundtable discussions. Thank you very much.
Wow, thank you so much, Anne. That was excellent. Yeah, so we've got just over a half an hour right now for questions, and would like to invite anyone who has questions to either type them in the chat or feel free to unmute yourself and you can speak your question for any of our 4 panelists.
Hi, this is Joe Davis. I live on the north side of the city of Milwaukee, lifelong resident from the city of Milwaukee. I've got a question for Ann and Brian. Just imagine this. You've grown up in the city of Milwaukee. You were born and raised here. Through the evolution of actually being raised in the city of Milwaukee, you've actually seen people go to jail because of mental health issues. But we thought they were mental health issues, but we didn't know it was actually neurological issues, possibly from the impact of lead water. You're impacted by your family members becoming very hostile in a very pretty much close-knit type family. You see a pandemic coming and you find that contact tracing is the name of the game in the pandemic, but you don't have contact tracing where you can actually try to find out exactly what's happening with the children in your community. You grow up in property, and I'll get to the question, Jenny, thanks for giving me a little bit of latitude, okay? You grew up in a property as a kid that after a while you found out that had lead by luck. You weren't impacted by it, but you see your friends and now you understand why your friends were what at that time we called a little off. You know, and I appreciate your advocacy, and this is not pointing a finger at anything, but you know, now I'm in my upper age. And we've had this, you know, we've had cryptosporidium here and we've had a whole lot of other health issues here. But somewhere along the way, we just don't get it right for our kids. And it's painful for us to see our kids go up into the criminal justice system, knowing that possibly it could have been prevented because, you know, it's no fault of their own because they were impoverished. So from my perspective, I wanted you to get a human side of what is going on. I'm not saying any of the other 72 counties and those kids don't matter, but you got to understand that a guy like me who grew up here in the city of Milwaukee, love this city. I've seen so many things broken in this city, poverty, but also everything turns to lead poisoning. You know, the lack of achievement in schools, right? I mean, and these are kids who grew up in these lead houses 20, 30 years ago. And now they're having children and they're in the same type of situation. Once you put it in context like that, Brian and Ann, these folks don't have a voice. What they're looking for is that you are their voice. And they can't cause holy hell, but you can. So what I'm asking, or the question that I ask is that, based upon the scenario that I gave you, is this something that you're really going to push towards? Because I may not ever meet you in the future or anything else, but I just wanted to put a personal context to the problem, the serious problem that we have as Milwaukee continues to grow.
Thank you, Joe. That story, I mean, really there's no words to express kind of, you know, like how I'll take that and use it, but it is stories like that that do make an impact on people like me. And I will say that since my position was created at the Department of Health Services, you do have someone now, and I think perhaps Ann could attest to this, that works on this full time, is very responsive to those individuals and partners who are willing to commit their time and energy to this. That's who I work with, but I also in charge with kind of being that person who's kind of a bit of a thorn in the side of our state agency partners that could be working more closely together and aligning our efforts. So I can tell you that I am committed to that. I do work on this. It is my sole responsibility. There are obviously a lot of staff who have committed to working on this issue, and they're the ones that kind of oversee our program. But as far as trying to kind of align energies and resources, that type of story it speaks volumes about why we need to continue to do this work. So I appreciate you sharing that.
Yes, I want to add that, Joe, your story is very powerful, and it's not unlike many of the members of COLE now who are, in usual cases, it's mothers of children affected. And that gives us more of an impetus to do everything that we can to try to get this hazard out of the north side, in particular of Milwaukee. It is criminal. It's immoral. It is a failing of society, and it's a failing of, frankly, political will. And it's going to take, well, it's a failure of leadership, but it's also a failure of organization of political will. And we have to have both in order to hopefully move the people who can provide an answer. So the people include at the state level, budget allocations. So, we encourage everyone to call their representatives, and in particular, the members of the Joint Finance Committee, to address these issues. But it also, I'm beginning to think more clearly that if we could mobilize foundations in Milwaukee, the way that the Get the Lead Out Coalition mobilized foundations in Cleveland to commit to literally having a pathway whereby you could institute some kind of mandate to actually certify properties as lead-free. And we really need realtors with a conscience to get on board that, because often it is realtors at the state level or associations that try to block this kind of thing, but they haven't heard from you. And they haven't heard from the mothers and aunts of affected children, and they haven't heard from those children. And so somehow we have to bridge that gap and open up the humanity of people to see what is going on and very clearly what needs to be done.
Ofelia or Tom, did you have anything you wanted to add? And thank you, Ann and Brian. And thank you, Joe, for that question and for sharing your story.
Yes,
Yeah.
Joe,
Oh, go ahead. Sorry.
Oh,
No, go for it. Go for it.
I didn't get an opportunity to see you, so yes, I agree. That story, it's extremely powerful, and I've been working in this area for a few years, and it's challenging. It's challenging in terms of have a really strong plan, and I've been advocating to say we need more resources on the north side. I feel like why we need to have these conversations, or representing an organization that we utilize resources to advocate and work with families. Why do we have to beg the government or the city to make sure they allocate enough resources so we can work with these families? The families intimidated when the local health departments follow up with them because they feel they got in trouble, right? They have probably other issues and they have other concerns. And community-based organizations have a connection with these families. Probably they're able to offer them more resources that they need, but it's always a financial conversation. And sometimes coming from an organization that they want to give us $30,000 to follow up with 300 families. What type of services are we going to be able to deliver to these families? We have to be responsible to ensure that we provide quality resources to these families. And, and it's time that not just, Department of Health Services or the state, but we need to hold not only, the state that is coming on board, but then also our local officials need to come on board, and we have to be willing to, get out of our comfort zone and, start collaborating with each other and pull all the resources together to make it work. Tom, go ahead.
Yeah, so I guess, to answer, the question, our group is just trying to be proactive about, what the city is doing and how they are protecting the citizens in the moment that they're doing something that can cause lead in water to spike. Okay, so for example, this past summer, I live in the River West neighborhood, and the city was getting ready to do construction work right on my intersection where I live. And I called and asked if they would be using heavy road braking, construction braking equipment, a heavy, like massive, sledgehammering machine that's massive concrete pulverizer. And they said, no, we're not going to be using that. And I said, okay, because when you use that, that is the machine that disturbs the lead laterals and causes lead to flake off the pipes and get into the drinking water. And they said, yes, we know, but we're not going to be using that machine. If we do use that machine, we will notify you so you can get a filter and a pitcher, but we're not going to use that machine. Well, a week later, I wake up to that very machine pounding the concrete out in front of my house. And so I called the number on the flyer for the Department of Public Works, and I said, you are using the machine in front of my house that you told me you would not be using. You are supposed to provide information to the residents in front of the houses where you are going to be doing this road construction that causes lead to spike in the water from your concrete braking. And the answer I got was, well, we knew we should have handed out the flyers to alert you of lead spiking in the water so you can get your pictures, but we didn't hand them out. And I said, well, I think you need to come down right now to my neighborhood and hand out the flyers and stop the construction work. So they did. They stopped construction work and they came down. And I live in a neighborhood where there's young families, there's high school kids, there's a cafe right by me. So, we can talk about all the things that the city's going to do and that they're going to keep us safe and abide by their, like, you know, protocols, but it's up to them to actually do it, right? They knew they were supposed to give me flyers to get filters and to let us know they were going to do the construction work. They knew they were supposed to do it, but they decided not to because it was more work for them to do it. So I think, you know, we can talk about all this, but, you know, the point is hopefully they listen to the concerns of real citizens on the ground. And when they go out and do the work that they're going to do, that's going to cause lead to spike, to make sure that we're protected in that moment. And hopefully that's, you know, to the point of where we're going to go here to get the pipes out of the ground efficiently and to not say we're going to do something and then not do it.
All right, we've got a question in the chat from Dorothy asking, how readily available are reputable contractors who are qualified to do lead mitigation?
I can address that in part. I can certainly follow up with more specific information on the location availability of lead abatement contractors. It, you know, it is an issue where we have a lack of qualified abatement contractors to do the work. There have been efforts over the last year or so to increase training opportunities. And this is where, you know, if you see a silver lining in COVID, this is one where a small one where virtual training, we've had to pivot to provide training virtually and figure out how certification happens that way. And so the reach of trainings and being able to be more flexible and adaptable and increasing qualified and certified workforce is happening. So our hope is that we'll see an increase over time, but there isn't enough out there right now to meet the demand. There's a larger workforce in southeastern Wisconsin, luckily, but that, I mean, Ofelia can certainly speak to this. It still isn't enough to meet the current demand. So it is something that we're paying attention to and looking at ways, innovative ways to incentivize and attract contractors to do this type of work, keep it something that they want to do on an ongoing basis, so that we have the availability of these contractors who have lead abatement supervisors, lead abatement workers on staff that can go out there and do this work. But a lot more work needs to be done in that area.
I can add, thanks, Brian. I think you brought a really good point. I think, you know, as we make an investment for lead abatement efforts, training, contractor training has to be incorporated into those dollars. One is needed, and the state of Milwaukee, I think, has the highest number of lead abatement contractors, but just because you have your certification doesn't mean that you have the skills and the qualifications to be able to do lead abatement. Since we started with the Let's Safe Homes program, one of the, you know, we're starting a brand new program. We're building a program from scratch, and as we are recruiting for contractors and assessing their skills and capacity, there is a lot of opportunity for improvement. For me, I don't call those challenges, but I call those opportunities, because it's an opportunity to bring those contractors on board and increase economic development, so, and workforce as well. And so when we bring dollars for lead abatement or lead hazard reduction, especially through either grant funding, we have to make sure that we allocate enough money to also be able to provide the training. Right now, what SDC is doing, we're in conversation with Department of Health Services, letting them know, hey, we have a group of contractors. They have the, you know, they have the certifications and they have the qualifications, but they may not necessarily have the skills. As you may know, previous years, the main focus was on window replacement and not so much on lead abatement efforts, such as, you know, aluminum wrapping, you know, carpentry. Lead abatement includes, not, you know, window replacement, doors, are a big hazard as well. Trim around the house on the inside and the outside of the home. So making sure contractors and the workers have the carpentry skills is extremely important, because just because one of the sometimes the misperception is that just because the families are receiving assistance through this program, it doesn't mean that we're not going to deliver the same quality of work. So through these programs and with DHS, we have a very high expectations of quality. And contract, we have a group of contractors that absolutely have excellent experience and skills, and we're trying to recruit them to become mentors and be able to equip more contractors. So we're open for suggestions, we open for ideas, but we do have some training dollars that we're allocating to make sure that we bring, as we increase capacity to do lead abatement in the homes, we also have to be willing and step out of our comfort zone to also bring contractors on board.
We have another question in the chat that reads, today's Milwaukee Journal Sentinel headline reads, why Milwaukee ranks high for stimulus because of growth, poverty rates, and overcrowded in housing. Is the city poised to wisely use any of these funds to address lead poisoning and other environmental health issues? That's from Louise.
I thought I saw that some of the money was maybe going to go to lead service line replacements. I do remember seeing, I got a text message from someone in our coalition that was about that. So I think it was maybe in the Journal Sentinel or some other local one, but I can give like a vague answer to yes, I heard some of that might go to lead service line replacements, but I can't get to, I don't remember much past that. And how wisely it will be used to replace lead service lines, that I don't know as well.
Anyone else feel comfortable addressing that question? We don't have anyone from city government, so. But yeah, Tom, thanks for that. And Rose made a comment that some years ago, some of our inner city residents were trained in lead abatement. However, when they began working, the contractors did not supply them with the required protective gear, so they became contaminated. Any of our panelists familiar with that or want to respond?
I can elaborate a little bit on that. Worker protection is one of the areas that also needs the focus. And it's just because they go through the training, it doesn't, it's one thing when they go to training and they say, this is what you need to do, but that enforcement and education is very, very important. And it's definitely an area for improvement. So, lead poisoning is not only happening at their home, right, in the families, in their home environment, but also the workers who are exposed and then could potentially bring that to their homes. A few years ago, we worked very closely with the Department of Health Services and providing contractors with the required information and training. But what we learned is that we were giving that information to the company owner and was not disseminating that information to the workers. So one of the areas that we need to work on is also providing that information to the workers and kind of empower them to understand their exposure and then be willing to request their personal protective equipment. Otherwise, they're going to be exposed to lead poisoning. So, once you give them that information, their whole face changes because it's their own decision. Once you give them that information and reinforce it, it's extremely important. One of the things that we have conversations through the Lead Safe Homes program, and this is when the standard is not the same across all the programs, especially when they're providing or doing lead abatement. It's if the enforcement is not consistent, they relax on the requirement. So one of the things that we try to do in the Let's Save Homes program or any housing program that we have is we budget it, so we put it on the cost. So when the contractor is giving us a cost, we include personal protective equipment, so then they know it's a requirement for the program. And we do site visits on the projects to make sure that we monitor that, and we remind the contractor. On the other side, due to the lack of not having enough contractors, we have to make a decision whether can we afford not to work with that contractor. But that reinforcement, it has to be consistent across all the lead abatement programs or any type of work. There is a big difference between a grant funded project and then a private funded project. You can see the big difference. They have to follow the protocol when they're working on a grant funded project, and then when they're doing private work, they're not really protecting the workers or the worker itself. They have to get their certification and knowledge about worker protection, but I think they need to understand why it's so important. So that is definitely an education opportunity and outreach opportunity.
Great, thank you, Ofelia. We've got a great idea in the chat from Elizabeth regarding involving realtors, and she's saying, could a nominal fee, say $500 to $2,000, be taken off the price of homes that are certified lead-free, so that home buyers' desire for this certification would create a market for the certification, that the realtors would be incentivized to supply it? Anyone able to address the likelihood of making that a reality?
I don't know to what extent. I don't know to what extent that would be a reality. Can you hear me?
Yes.
Yeah.
Mm-hmm.
I don't know to what extent that would be a reality, but I think that we somehow need to assemble realtors of conscience and realtor organizations, and see if we can't come to some agreement about ways to certify properties so that the children do not literally become the canaries in the coal mine. And yeah, I actually had a conversation with someone who was in a position of authority within one of those organizations, and he said that this was something near and dear to his heart. So it may take reaching out individually to people to then cause some kind of shift within the organizations. I just wish that people could understand how debilitating this is to these children, and how, as long as that lead hazard remains, it's not just the children who live there today, but future generations of children, and often many of the families in this impoverished part, north side of Milwaukee, they move often, and so they move from one lead hazardous home to another. It's just I just wonder what would be an effective way to change the dynamic within realtor associations. And I feel like maybe if we reach out one-on-one, that ultimately we might be successful to getting the whole group to come along. Obviously, we can't just reach out to one person, but maybe that's a route into the organization as a whole.
Yeah, and Elizabeth posted a follow-up comment asking, can we move beyond realtors' goodwill and make it financially motivated? That seems to work better with realtors.
Yeah.
I guess my question here is, we're thinking about when somebody's buying a new home and what they can be protected from in terms of what the reaching out to the homeowner realtors association can do? Or is it, are we thinking about people renting properties and how to make sure that the landlords are abiding by certain regulations? Because, you know, there's lead paint disclosures that we all sign when we lease a property, but there's never ever anything to tell you about the water in your homes when you lease a property. Maybe in the last year or so, that's changed. I lived in my apartment for 3 years, but every time I've signed a lease, I've never gotten anything from the landlord that was a lead and water disclosure, ever. You sign them for lead and paint, but you don't get anything ever as a renter in our city on lead and water. Maybe that's changed in the last couple of years. So my question is two things: is if we're going to target the Wisconsin Realtors Association, what is the specific question or demand, and who are we trying to protect? A homeowner, a brand new homeowner, somebody who's renting from a landlord? What are we trying to protect them of that we need the Wisconsin homeowners to get in the middle of? Can't we just go to the state legislature and enact some kind of law, push for some kind of law to be implemented? Why would we go? I mean, it's great to have that as our resource too, but you know, there should be laws that we can push to have a ordinance in place. So I guess my question is also the city of Milwaukee, we've identified that it's city of Milwaukee foreclosed homes that they sell back to the community. And we know now with tons of evidence that homes built on vacant lots have been connected to old pipes in the ground. We know that this is true. We don't want to acknowledge this, but we know this. So if we're going to start to talk about real estate and real estate development and markets and housing, we need to address what we do know and our major concerns: city-owned tax foreclosed houses, and to make sure that the filters are being kept up until we can get the lead service lines out of these city foreclosed homes. The city is a major landlord with 3,000 residential properties, and also the vacant houses that are being built on the houses that are being built on vacant lots. Now, nobody wants to discuss that. I've raised this concern for 3 years and nobody wants to talk about homes built on vacant lots connected to old pipes in the ground. So if we're going to start to talk about real estate and how to protect homeowners, we need to also start to acknowledge that homes built on vacant lots in the past and probably currently are being connected still to old pipes in the ground. And that needs to be covered and brought up with the Wisconsin Realtor Development Association, the Department of City Development, whomever, to not just have that something that got brushed aside. So when we talk about real estate, we got to keep in mind that aspect, which is confirmed that that's been happening.
So Joe entered in the chat about the Mike Ruzicka, the president of the Greater Milwaukee Association of Realtors, and that he's responsible for managing the 5,000 member professional organization that represents an industry with annual sales of over $15 billion. So their core services consist of government affairs, ethics enforcement, multiple listing service, and promotions. So yeah, that definitely seems like someone to target with some of these ideas. Also, Carla, thanks for posting about your availability to help. Carla is the new environmental health specialist on lead and asbestos inspector for the state of Wisconsin in the Bureau of Environmental and Occupational Health. So Carla, thanks for being here. Noticing that we've only got 2 minutes left. Ooh, yeah, Karen, thank you. Great question. Karen says, what is one thing we each can do either for advocacy beyond already mentioned lawmakers or in our own homes?
I can go first. I can't lobby or advocate, but I would encourage you to take this information today, and if there is a particular area of interest, you know, sometimes that they can get more mileage out of that and really promote that and focus on that. So get educated. information, reach out if you have questions, need more resources. I want to be available to be that resource.
Thanks, Brian. Oh, thanks, Anne. Oh, what a weird situation with your computer. Oh no. Anne and Ofelia and Tom, did you have any things you wanted to add to answer Karen's question about one thing we can do?
Absolutely. I can, I think, at the personal level, I encourage you to make sure that you share this information. I'm sure you may have a relative, you may have friends. Sometimes we walk by the neighborhood and we can tell if a property has peeling paint, and we want to empower those parents and we want to empower those children. So I think sharing, knowledge is power. So the more we talk about this issue and the more we encourage the families to learn more about it, we are doing at least we're taking the initiative to share this information. We need to request more transparency, and we need an action plan. The resources that we mentioned today, is that enough? Absolutely. And I don't think we can afford to go another 10 years. It would, for me, in my opinion, it would be very embarrassing to have this conversation in 10 years. If it's not now, then when? And I think, it's not only the financial resource, but I think as you may be representing organizations, we have to come together and we have to be willing to get out of our comfort zone and start challenging each other to make sure that we deliver results and we demonstrate progress. It's not just about talking about the problem, but we definitely want to see that percentage and the number of children be lead poison reduced significantly, not by 1%, not by 0.5% every year or every 3 years. Holding our local health departments accountable and making sure that we continue to develop partnerships. And absolutely, it's not, I would say it's not impossible to fund this because, we're not only dealing with lead hazards in the home, but then also water. And once we address the main issues, then, lead poisoning is not going to go away as a whole, but we're going to attack the biggest problem. I think we continue to invest in after the fact, right? Try to pay for the consequences rather than we have to really put all of our energy and efforts into the prevention side.
Thank you, Ofelia. And Anne typed in the chat encouraging folks to join Cole. And I put a note in the chat earlier to say that I will follow up with an email to everybody with the budget asks that are in the governor's budget that relate to lead issues that Brian and Anne shared, so that you'll have those. Oh, yeah. And thanks, Brian, that the Joint Finance Committee is going to have their listening sessions. And as I recall, there's only one that's going to be held via Zoom. All the rest are going to actually be face to face. That's what I recall reading. So,
yeah, that's correct.
Yeah. And the
there is a Governor
face-to-face ones
Evers
are not. They're not.
Governor
local to
Evers
us.
is all virtual. Sorry, Jenny. Governor Evers
I'm
listening
sorry.
sessions are all virtual.
Okay, great. Thanks, Brian. And noticing that we're over time. Thanks so much for everyone for sticking around. And and Ofelia is suggesting contacting her. So great. Thanks for sharing your contact information. Just a quick reminder about those events that we talked about at the top of the hour, the river cleanups and with Nearby Nature and Milwaukee Riverkeeper in April, and our May program on May 17th about Project Drawdown. And David, David Thomas, did you want to say something real quickly about our big initiative that's starting tomorrow?
No, just that I posted a link to the program, Building an a multiracial environmental community, and people can find information about that on the Sierra Club webpage calendar as well.
Yep, and Karen made the good point that there are other environmental issues to highlight in the budget sessions when we either attend them or when we email our legislators. So thanks so much, everybody. Sorry we went a few minutes over. Oh, go ahead, David.
Jenny, I don't know. I don't think this came up early in the announcements, but the Sierra Club has an action alert going out Wednesday. If folks will watch their email, the DNR is going to allow, or was planning to allow, Waste Management to dig up a Superfund site in Menominee Falls, and the Sierra Club is supporting local organizations that want to call for a pause on that and to get an environmental impact statement. So watch for that email on Wednesday.
Thanks, David. All right, well, many thanks to our panelists. Thank you so much, Ofelia, Tom, Anne, Brian, for your excellent presentations and for taking this time. Thank you, thank you. Yep. And thanks for all that you're doing in Milwaukee and in the state.
Thanks so much, Jenny. You
Thanks, Karen.